About 30% of patients with epilepsy are not going to have their seizures controlled by medication alone. These patients represent a patient population that we can help. It's of paramount importance, particularly in kids, because a seizing brain is not a brain that can develop to its fullest potential. So the advancements in both our radiographic technologies as well as our neurosurgical technologies allow us to map and localize what we call an epileptogenic zone, or the area of the brain that is causing the seizures. Our newer minimally invasive surgical techniques allow us to go in and target these areas with minimal risk or damage to the normal brain. The technologies that allow us to do this are 1, robotic guidance, 2, laser interstitial thermal therapy, which allows us to put a tiny catheter into the abnormal areas, destroy the area causing the seizure, but leave the rest of the brain intact. And third, techniques that fall under the category of neuromodulation. And these are deep brain stimulation to help control epilepsy, as well as a technique called responsive neurostimulation to help control epilepsy. There is a little girl that we treated, 6 years old. Now, she had an area of her brain that was abnormal, that was constantly causing seizures close to the part of the brain that controls the motor function in her arm. She had never been able to lift her left arm above her head. It was very, very weak. We did a minimally invasive surgery where we inserted a tiny cannula, which has a laser fiber to allow us to heat up and destroy this little bit of abnormal tissue while keeping the rest of the brain completely untouched and safe. And the next morning, she lifted her arm up and gave me a high five for the first time in her life. She went home that same day. So this is what we can provide with epilepsy surgery and with the minimally invasive epilepsy surgery techniques. We now have options to offer almost every patient with medically intractable epilepsy. Here at Orlando Health, this allows us to provide the best possible treatment option in the safest, most minimally invasive way for your child's epilepsy.